Good afternoon, everyone. We're back for our weekly update. I'm joined by Dr. Morrison and Chief Nurse Dowling, as usual. I'll just have a few brief comments at the top. Just to begin, I'm very pleased to see that we haven't seen a spike in cases over the last number of weeks, which puts us in rare air in the country, really, when you look at how things are going here. So we're very grateful for that, very grateful that Islanders have been so attentive to the rules and regulations that have been put in place for this pandemic. When we were looking at this in mid-December, we were very concerned about Christmas gatherings, of course. We seem to be through the time frame now where that looks like things have gone really, really well with that, so that's a good sign. We were concerned about gatherings at New Year's Eve, of course, and we're now getting to that point where it looks like we can hopefully, knock wood, say that we've been through that as well. So it's a good story for us here. Shows how we've been paying attention and adhering to the regulations put in place and the protocols, which have been difficult and challenging, of course, but it's a good sign. Also, I just say that, should we continue on this trajectory, that would put us in a good position to look at easing restrictions here on the island first, of course, which would be a good thing and good news for us here. We haven't talked in great deal about it, but I'm sure that once we get there, if we continue on this trajectory, that's the way we will roll this out as a province, similar to what we did early in the year, and that was that we will see some further easing of regulations and restrictions here on Prince Edward Island first, and then we will look beyond our borders to see how things are going, and when it's safe to do so, look at those situations then. So, like I say, I think that's a nice flicker of hope at a time when other jurisdictions aren't enjoying the level of hope that we have here. So let's be grateful for that, but let's not lose sight of how we've gotten here, and let's not let our guard down, as we always say. So with that, I will turn it over first to Nurse Dowling today to give us a brief, and then on to Dr. Morrison. So.
Thank you, Premier. Good afternoon, everyone. I'll start by offering thanks to Public Health Nursing for continuing to coordinate the vaccine rollout. And this week, we have continued to extend further into our long-term care and community care homes. Thank you as well to other nurses and healthcare providers who've offered their assistance to support the vaccination program. The second dose of vaccinations have started, and as a reminder, healthcare workers who have received their first dose are reminded about their attending their second appointment for their dose of the COVID vaccine. If healthcare workers are unsure of your appointment time for your second dose, please contact your manager to confirm your time. And currently, we are still on track to follow the Chief Public Health Office's guidance, and with our dosing allocation of vaccine to continue completing the first dose in all long-term care and community care facilities by the end of January. A brief reminder about our procedures at our COVID testing clinics to all our regular repeat clients who have regular testing and the general public of our protocols. Everyone's reminded to please keep the windows of your vehicle up until you are directed to lower it by staff at the center. And all passengers over the age of 2 in the car should be wearing a mask at all times unless you're directed by staff to lower your mask for this testing. Please don't bring unnecessary passengers in the car, and this includes pets, to the testing clinics, as it causes unnecessary stress and risk to staff. Service dogs are able to be with individuals being tested if necessary. If you have symptoms and do not have transportation to a testing site, please call for an appointment and your test will be arranged. We ask that you do not take a taxi if you're requiring a test for COVID-19 symptoms. Please remember, it's important to continue and seek health care if you need it and attend your health appointments. People with cold and flu-like symptoms can call their family doctor or nurse practitioner or 811 to be referred to our cough and fever clinics where they can be assessed and receive treatment. If you're in need of urgent or emergent care, please go to an emergency department or call 911. The new bridgethegap.ca website provides information about all levels of mental health services on P.E.I., those provided by Health P.E.I. as well as our community partners. And we're grateful to be able to offer most of our regular health services while complying with the appropriate public health measures in our current state. Thank you to all of our healthcare providers for your dedication to your clients and patients over this past number of months. Thank you.
Thank you, Marion. Good afternoon. Today's briefing, I hope, will be a bit shorter than last week with my updates on COVID-19 and P.E.I. in Canada, also on the vaccine rollout, testing, and also wakes and funerals. There is one new case of COVID-19 to report today. This individual is a male in his 30s with a history of recent travel outside Atlantic Canada. Contact tracing is complete, and this person is self-isolating. There is a flight notification related to this case. Of course, anyone who traveled on Air Canada Flight 8302 from Montreal to Charlottetown on January 4th is required to self-isolate in accordance with the public health order. But in addition, they should be monitoring themselves for symptoms and arrange for testing if they develop any symptoms of COVID-19. We currently have 8 active cases. They are isolating at home and are being followed daily by public health. Since the pandemic began, we've had 103 cases of COVID-19, along with no hospitalizations or deaths. It was 1 year ago this week, the World Health Organization reported the first death from COVID-19. A year later, COVID-19 continues to have an unprecedented impact worldwide, with over 91 million cases and almost 2 million deaths. The United States has reported almost 23 million cases of COVID-19. In the first 10 days of 2021, the U.S. has reported over 2.3 million new cases of COVID-19 and 27,000 deaths. The situation in Canada continues to surge with over 668,000 cases and 17,000 COVID-related deaths. In the past week, case counts were up in Saskatchewan, Quebec, Ontario, and New Brunswick. And New Brunswick has 205 active cases, the most since the pandemic began. Overall, there was a 15% increase in cases in Canada last week, with an average of 8,000 new cases per day. And we know hospitalizations and deaths lag behind the increased case counts by as much as several weeks. Last week in Canada, an average of 4,336 people with COVID-19 were being treated in hospital each day. There was a 23% increase in deaths in the past week in Canada. Health systems across the country are struggling to cope with the burden of illness related to COVID-19, especially in jurisdictions where infection rates are high. While many provinces have implemented strict public health measures, including curfews, in P.E.I. we are in the fortunate situation of gradually easing back to the new normal. We would not be in the position we are in today without the diligence and commitment of individual islanders and businesses. Not only have islanders been cooperative, you have demonstrated you are willing to follow these measures and do what is necessary to protect each other and your community. So thank you. As you know from previous briefings, we started to administer the vaccine to frontline healthcare workers involved in the COVID-19 response and long-term care and community care residents and staff across the province. As of yesterday, 4,226 doses of COVID-19 vaccine have been administered, including 1,154 second doses of the immunization. And after the first week in long-term care, over 25% of long-term care and community care residents have already received the first dose of the vaccine. And by the end of this week, all long-term care residents and staff will have received their first dose of the COVID-19 vaccine, and this is great news for the province. And by the end of next week, we expect that everyone living and working in community care facilities as well across the province will receive their first dose of the vaccine. And then, beginning the week of January 25th, all long-term care and community care residents and staff will actually start receiving the second dose of the vaccine. And receiving the second dose of the vaccine is critical to achieving the full benefit of the immunization. So all long-term care and community care residents and staff will have received or should have received their second dose by February 16th. Our plan to vaccinate seniors in care facilities as quickly as possible is done out of necessity. We know that across Canada, seniors and congregate living situations have been disproportionately impacted by COVID-19. 63% of COVID-19 deaths have been associated with long-term care and retirement homes. And I know we'll all feel better when this group is immunized and protected against COVID-19. As soon as everyone in the long-term care and community care sectors is immunized, our focus will turn to vaccinating others in congregate living situations, including group homes, community residential facilities, shelters, and other priority groups, including Indigenous adults and communities and other healthcare workers with direct patient care. For instance, family physicians, OR staff. So in the first quarter, between now and the end of March, we anticipate that everyone living and working in long-term care and community care and other congregate living arrangements, as well as healthcare workers who provide direct patient care, will be vaccinated. But we also plan to start immunizing those over 85 living in the community, Indigenous adults in communities, partners in care, and registered rotational workers and truck drivers during this first quarter of 2021. Beginning in early February, these individuals will be able to book appointments for clinics that will start in late February, early March, and there's more information that will come in the weeks ahead. As we proceed, all Islanders will be advised about the location of public health clinics and how to schedule an appointment. As I've said before, we're following national guidelines for the priority groups to receive the immunization. It will take months for everyone to be vaccinated, but there will be vaccine for everyone. It would be ideal if we had enough product to offer every Islander the vaccine within the next 2 months. This is not the case. So we are anxiously awaiting confirmation of increased vaccine supply in the spring, and I know the rest of Canada is in the same position. But I will be clear, as we receive vaccine, it will be administered into the arms of Islanders as quickly as possible. The COVID-19 vaccine is an important tool to help stop the pandemic. The availability of a safe and effective vaccine is definitely a game changer in our fight against COVID-19. The vaccine is another important layer of protection against the virus. Until we understand more about the degree to which the vaccine protects individuals against the disease and also against infection and transmission, we will need to continue to protect ourselves and others by using all the tools available. So even after we are vaccinated, we will initially continue to follow public health measures such as maintaining physical distancing, washing our hands often, and wearing a mask in public places. So stopping this pandemic requires us to use all the tools available. Vaccines work with our immune system to help us fight the virus if we're exposed. And public health measures reduce the chance of being exposed to the virus and spreading it to others. Together, the vaccine, in tandem with public health measures, provide the best protection against COVID-19. We are expecting updates today or tomorrow to the national recommendations regarding the following groups receiving the COVID-19 vaccine: pregnant and breastfeeding women, immunosuppressed individuals, and people with autoimmune conditions. Individuals in these groups can receive a complete vaccine series if the risk assessment deems the benefits of being immunized outweigh the risk to the individuals. And decisions should be made by the individual in collaboration with their healthcare provider, and we'll be providing that additional information as well to our providers. Testing continues to be a key component of our provincial pandemic response. As we've stated previously, early detection, isolation, contact tracing, and quarantine are really good principles of public health, but we can only do the detection by testing for COVID-19. P.E.I. is second only to Ontario in testing per capita in Canada, having tested 529 people per 1,000 population. The Canadian average is 386 tests per 1,000 population. It's important that anyone who develops symptoms of COVID-19, even mild ones, should be tested for the virus and self-isolate until the results are back. As a reminder, the symptoms of COVID-19 include new or worsening cough, shortness of breath or difficulty breathing, fever, chills, sore throat, runny nose, sneezing, congestion, acute loss of sense of smell or taste, headache, muscle, joint, and body aches, feeling unwell, and unusual tiredness. And thank you to Health P.E.I. staff who are working at the testing clinics across the province and to the provincial lab staff who have processed 82,000 COVID-19 tests since the pandemic began, including 2,700 in the past week. And finally, I'd like to clarify the requirements for individuals entering P.E.I. from out of province to attend wakes, funerals, and burials. Pre-travel approval is required, and individuals should, wherever possible, plan to be in the province 24 hours in advance of the event to ensure they can be tested and receive the results. Upon arrival in P.E.I., individuals must self-isolate for 14 days or the duration of their stay if that's shorter. But individuals can come out of self-isolation to attend the wake, funeral, or burial, provided they undergo testing within 24 hours of arriving in P.E.I., and they need to receive the first negative test prior to going. The self-isolation exemption to attend the wake, funeral, burial does not apply if the out-of-province attendees are experiencing any symptoms of COVID-19. Everyone wants this pandemic to be over and for our lives to return to normal. I had someone write to me and say, we really hope 2021 is a return to essential services like hugs and handshakes. And we've referred to COVID fatigue months ago, and I think it's probably that continues. But we have to remain vigilant and committed, and we have to continue to follow these public health measures. To date, we have done so well and come so far. As the Premier mentioned, it's my personal plea and shared by the team. Now is the time for us to really stick with it and follow these measures for a bit longer, and now is not the time to throw caution to the wind. So as we continue our journey with COVID-19, we do have much to be grateful for. We have access to safe and effective vaccine, and our vaccine rollout plan is off to a good start. We've not had any hospitalizations or deaths related to COVID-19. And we have good processes in place to support pre-travel approval, testing, self-isolation, and border screening. To date, thanks to the support and resilience of Islanders, we have been able to meet all the challenges presented by COVID-19. And our health system is not under duress, and we continue to have access to a full range of healthcare service, including elective procedures. So as we continue this journey in 2021, let us continue to be patient and continue to be kind. Thank you.
Thank you, Dr. Morrison, Chief Dowling. We will now open up the line to questions from our friends in the media. So,
Steve Bruce, CBC.
Yes, hello to you all. I guess this question's for Dr. Morrison. We saw the federal government release of vaccine distribution numbers today, laying out how much will go to each province every week right up to the end of February. And it looks like P.E.I. is the only province that won't see its shipment sizes of both Moderna and Pfizer increase at all over that time. It just stays the same each week. Do you know why that's the case?
Well, I think we have, we knew we were having 975 doses per week of the Pfizer product, and we did have our shipments confirmed of Moderna that are coming not on every week, but twice in our second shipment of Moderna is arriving later this week, and then we have 2 doses of Moderna in February. The shipments have been allocated basically on a per capita basis. We had initially probably received a few extra doses in our first shipment because of the size of the way the Pfizer comes in certain trays, so we may have had a little bit extra there. You may remember that we had the same amount of vaccine in our first shipment as Nova Scotia, New Brunswick, and Newfoundland, I believe, at that same time. I think P.E.I., as the rest of the country, we will probably hear more in the next few weeks about anticipated additional vaccine allotment and supply for later in March and into the spring, and so we're waiting to hear some of those numbers.
And hypothetically, even if we were to start getting bigger shipments right now, do we have the capacity to get those doses out to islanders immediately, or would they be waiting in storage for some time? I guess, put another way, what's standing in the way of us getting the vaccines out as soon as they come in, and do we have plans to increase our capacity to do that?
No, I mean, there's the limiting factor is the actual vaccine. And I think we may have talked before, Steve, about the fact that, for instance, when we get influenza vaccine in the fall, within a 2-month window, basically we were able to distribute 80,000 doses of influenza vaccine. And that's with our nurses and pharmacists and public health nursing being the main vaccinators. So we would be using other immunizers if we all of a sudden got additional doses tomorrow. But that is what we will be planning to do as vaccine supply gets more as the spring goes on.
Okay,
I
thanks so much.
understand, Steve, that, at the First Minister's meeting last week, we talked exclusively about vaccine rollout, and we did make it known to the Prime Minister and the federal government that we have the ability and the capacity to do this quickly. And we have been given a pretty significant indication that the federal government is working very, very hard to secure more vaccine and with the desire to get it out as quickly as possible. So I think we're in a good place here, as Dr. Morrison has said, and the one snag for us here in P.E.I. is just the access to the actual vaccine. We're better positioned than most with our size, I think, is another factor too. So.
Understood. Thanks to you both.
Louise Martin, CBC.
Oh, hi. Good afternoon to you both. Actually, I'm going to ask you both this question, so I'll start with you, Premier King. You seem to hint that further easing of restrictions could be coming down the line, easing within the province before looking beyond our borders. So I won't bother asking you about the bubble at this point, but what kind of further easing could we potentially see in the coming weeks should we not see and continue on this path we're on and not see a spike in COVID-19 cases?
Well, hi, Louise, and thanks. And Dr. Morrison can expand on the answer that I will give. But essentially, I think I feel we're on a path, if we could stay on it, to where we could get back to what, as she has indicated in her notes, what the new normal was pre-circuit breaker here in P.E.I. I think that the reward for Islanders has always been of easing within our own borders here, and that has been sort of the incentive, I think, along with everything else for all Islanders. And I feel that because Islanders have done such a good job adhering to the public health protocols, that we're in a position that others are not to do that. So I think just much like we did in early summer, late spring, we would look to further easing, making life a little bit more freer here in P.E.I. first, and Dr. Morrison may want to expand upon that. But essentially, that's the way I would assume we're heading that way.
Hi, Louise. So just to continue on with that, for instance, if you're easing up restrictions back towards a new normal, it would be around the personal gathering numbers, as well as the organized gathering numbers. So right now it's a household plus a maximum of 10 individuals. It would be personal gathering numbers of 20, which was what we had earlier in the fall, as well as right now there's in terms of organized gatherings, there's the 3 groups of 50, and that organized gathering number would also increase, and that's certainly would be what we would be looking at. For instance, that would allow some larger numbers at faith gatherings, sporting gatherings, and entertainment, for instance. We're very conscious, too, that so much can change and how quickly it can change, and I think we've seen that in New Brunswick, how that has happened. So we're wanting to look ahead, but realizing and hoping that nothing does change that, but not wanting to look too far ahead either.
So there's no, just to be clear, there's no targeted date for easing of these restrictions. This is just sort of on the horizon at some point?
I mean, I think what we have been looking at is January 25th, and that would, from an EPI point of view, make sure that we have sufficient time to see any increase in cases that we've noticed here following holiday travel, students arriving back to post-secondary institutions, New Year's Eve celebrations, those kind of things. So that is certainly the date we have in mind, and we had put some of these restrictions in place until that time, so the hope would be to ease them up if we can on that date.
Thank you. Is there any update on the online vaccination tracking? I know you had said that was sort of the goal, is to get the numbers put online.
I think we certainly spoke to communications earlier, and I think they're working on that. What their intention is to have a dashboard up on the website, and so that would indicate a number of vaccines given, vaccines received, and almost have a graph along with that. So I know that's in the works, but sometimes these things take a little longer than I think they and I don't know how to do all that stuff, so we're relying on other people to do that. So they are working on it, and I anticipate that will be shortly.
Thank you both so much.
You're welcome.
Dave Stewart, The Guardian.
Hi, folks. I'm not quite sure who this question is directed to. I assume it's Marion Dowling, but I'll fire it out anyway. Do we know when seniors at home can start booking appointments for vaccinations? When and how?
So, hi, Dave. I'll just mention, because I think maybe it's good to highlight what was in the notes. So it's our hope, and this will be in conjunction working with Health P.E.I, that seniors, and we would be starting with those 85 years of age and older, and I mentioned a couple of other groups that we hope to be able to start vaccinating by the end of February. And so there'll be a phone number to be able to call, and there'll be more information on how to book those appointments. That hopefully will be in place by early February. So that we'll be back here to give you the exact number and way to book those appointments. So that's a conversation that's continuing with Health P.E.I.
Thank you. And obviously everybody is keeping their eyes on the unfolding situation in New Brunswick. Are we learning any lessons by what has happened in our neighboring province?
Well, I have been, of course, in touch with our counterparts in Nova Scotia, Newfoundland, and New Brunswick. And I think it's a good reminder that if people have symptoms, and I know Dr. Russell has spoken about this publicly, if people have any symptoms, they should not be going to attend social events. I think some of the gatherings that were being discouraged across the country over the holiday period, I think may have taken place. And that's certainly, but particularly what Dr. Russell has mentioned, people had some symptoms, did not get tested, and went to some gatherings, and then it spreads quickly. And as we've all sat here at this table and said for many months, this is a tricky virus, and it's not something you see, and no one intends to spread it, but its impacts can be quick and have consequences. There are hundreds of people having to isolate in New Brunswick as a result of being contacts of cases, in addition to the over 200 active cases. So it's had a significant impact in that province.
And let me add, Dave, if I
Thank you
could
also.
just
Oh,
simply
sorry.
that I think you've asked what we've learned. I think from the beginning, I believe we felt that we're only as good as the rules we follow. And we've had a good uptake of following rules and protocols here. I think what we learn here, at least from my perspective, is when you see a spike in cases in Nova Scotia or New Brunswick, that is a lot closer to us than maybe British Columbia, for example, or other provinces. And I think it does serve as a reminder to everyone here of the importance to err on the side of caution and to do some of these things as hard as they are, not just for ourselves, but for others. And I think that, I talked with my counterparts as well and other premiers, and they are envious to a certain degree that so many islanders have been so diligent in following along. And it's something that over the course of the last 10 months has really been a great comfort, I think, to all of us here, is that Islanders have taken this seriously from the very, very beginning. And when we ask Islanders to dig in further, they do, and we continue to do that today. We have a lot on the horizon to be hopeful and wishful for, but we have a lot of work to do before we get there. And so that we just have to keep plugging away here and doing these things. And I have great comfort in the fact that Islanders will do it.
Thank you all so much.
Laurent Rigaud, La Voix acadienne.
Oui, bonjour, docteur Morrison. J'avais une question sur l'auto-isolement de 14 jours. Vous insistez pour dire que c'est toujours très important. Je voulais savoir où en étaient les discussions pour réduire cette durée et si c'était envisagé, par exemple, d'avoir, par exemple, une durée d'auto-isolement différente si on revient de la bulle atlantique, par exemple, si elle revient, par exemple, 7 jours plus un test, si on pouvait faire des différences comme ça.
Bonjour Laurent. Et puis, bonne question. À ce moment, au gouvernement fédéral et ici à l'île du Prince-Édouard, on est en train de regarder, discuter si on peut réduire la période de temps de s'auto-isoler de 14 jours, ou peut-être réduire ça à 10 jours, 7 jours. Mais à ce moment, on s'inquiète un peu à cause du variante du Angleterre et de l'Afrique du Sud. Je sais qu'il y a des projets qui regardent si on peut faire ça, réduire le temps. J'espère que oui, et j'imagine avec les tests, à un moment donné, on peut réduire la période. Mais pas encore. Mais c'est encore un point de discussion.
Merci. Et j'avais juste un follow-up sur cette question. Aussi, sur la possibilité peut-être de faire des tests rapides. Il y a plusieurs mois, je crois, on en avait parlé, des tests pour voir si on a des anticorps ou ce genre de choses. Et, pardon. Je voulais savoir si les discussions se poursuivaient avec le gouvernement fédéral pour mettre en place, par exemple, des tests à l'arrivée rapide où on a la réponse tout de suite si on a le virus ou pas.
Bonjour, une autre bonne question. On a des tests qui commencent à être les tests rapides qui sont moléculaires, qui sont un peu plus, qui sont meilleurs que les tests il y a quelques mois. Alors, on commence, on en a, et puis on commence à parler comment on doit les utiliser. On a la capacité avec le laboratoire, avec les tests le PCR, et qui sont assez rapides et on a les résultats dans plusieurs heures. Alors, on n'a pas besoin autant. À ce moment, même si vous avez un test négatif, et puis c'est depuis plusieurs mois, on est demandé si on a un test négatif en arrivant ici à l'île du Prince-Édouard, on sait que ça change rien à propos de ton période d'isolement. Et on ne veut pas que quelqu'un pense que, oh, je suis négative en arrivant ici, je ne dois pas isoler. Parce qu'on sait que la prochaine jour, le jour après, il peut devenir positif avec COVID-19. Alors, c'est toute partie des discussions, mais je pense qu'il y a des cas que les tests rapides sont une bonne chose. On les a utilisés, pour exemple, quand on a essayé de faire beaucoup de tests avec les jeunes entre 20 et 29 ans. On a fait plusieurs pour nous aider à ce moment. Alors, c'est quelque chose qu'on discute, qu'on apprend chaque mois, et si on a besoin de les utiliser ici, on peut en faire.
Merci beaucoup.
Gabrielle Trumont, Radio-Canada.
Bonjour à vous tous. Ma question est en français pour la doctoresse de Morrison. Docteur Morrison, vous avez parlé tout à l'heure de ce sujet, mais je voulais que vous nous en parliez en français. La semaine passée, on sait que le Premier ministre du Canada, Justin Trudeau, a dit qu'il était frustré par rapport à la lenteur de la vaccination dans les provinces. Il disait que les provinces ont le vaccin, mais les gouvernements provinciaux tardent à administrer ce vaccin-là chez la population. À votre avis, est-ce que vous êtes satisfaite de la vitesse avec laquelle la vaccination contre la COVID-19 se déroule présentement ici à Lille?
Merci pour la question. Et puis, la réponse est facile pour moi à ce moment. Je suis très satisfaite qu'on fait les vaccins ici en beau temps. Ils arrivent et on est en train de faire les vaccins. Et j'imagine que c'est... même d'avoir donné tous les vaccins, première dose pour les personnes dans les résidents d'établissements de soins de longue durée et de soins communautaires avant le 22 janvier. C'est assez rapide, vraiment. Alors, je suis satisfaite et je sais que ça va continuer et je sais que tous les insulaires, on a parlé de ça avant, on bénéficie quand quelqu'un d'autre est vacciné. Mais le but est que 80% des insulaires des adultes soient vaccinés ici. Et alors, c'est un processus qu'on commence, mais à ce moment, je suis contente. Et puis, si on a la chance de faire plus de vaccins parce qu'on ne reçoit plus, on va le faire.
Et vous avez dit que vous êtes satisfaite avec cette vitesse avec laquelle la vaccination se déroule ici, mais lors de la deuxième phase de vaccination, la province va devoir administrer le vaccin à un public beaucoup plus large. On va avoir plus de travailleurs essentiels, des travailleurs à rotation qui vont se faire vacciner. Est-ce que vous avez déjà commencé à préparer un plan de vaccination à large échelle pour cette deuxième phase? Et si oui, quel est le plan de l'île pour accélérer la vaccination lors de cette deuxième phase?
Alors, on va avoir plus de personnes qui peuvent faire les vaccins. Alors, les personnes qui travaillent aux pharmacies et aussi d'autres infirmières et médecins avoir les plus grandes cliniques publiques pour essayer de vacciner de plus grand monde par le printemps si on reçoit plus de vaccins.
Parfait, merci beaucoup.
Merci.
Julien Lecacheur, Radio-Canada.
Bonjour, Dr Morrison. Juste pour rebondir sur la question de ma collègue Gabrielle, est-ce que ça veut dire que les pharmaciens de l'île du Prince-Édouard vont pouvoir administrer le vaccin de la COVID-19 dans des pharmacies?
À ce moment, c'est les pharmaciens qui vont nous aider et puis je sais qu'ils veulent nous aider à faire les vaccins quand on n'a plus de vaccins ici à l'île du Prince-Édouard. Ça va peut-être être aux pharmacies, mais ils vont peut-être nous aider dans les cliniques qui sont un peu plus, dans les cliniques les plus grandes. Alors, c'est partie de la discussion.
Deuxième question pour vous, Dr Morrison. Je lisais un article de mes collègues de Radio-Canada en Ontario qui expliquait qu'à l'heure actuelle, la Saskatchewan est la seule province où tous les tests de dépistage peuvent détecter le variant de la COVID-19. J'aimerais savoir comment ça se passe à l'île du Prince-Édouard. Est-ce que vous pouvez détecter le variant de la COVID-19? Est-ce que vous pouvez faire ça sur l'île ou est-ce que vous devez envoyer vos échantillons à l'extérieur de l'île?
Alors, tout notre cas positif pour détecter le variant est envoyé et ça arrive depuis les mois au laboratoire national. Alors, c'est pas ici, mais on fait ça automatiquement avec tous les cas positifs.
À Winnipeg.
Ah oui.
Merci beaucoup.
Okay.
Thank you both. I think that brings an end to our news event today, so thank you very much and stay safe.